Hello everyone, good to see you back. So today I will be talking about the introduction to gynecology, preoperative, postoperative care, gynecological examinations and procedures. Now, as an introduction to gynecology, gynec examinations and pre-op and post-op procedures, first of all let us understand what is gynecology. So gynecology is a branch of medicine that focuses on the health of the female, the reproductive system, including the ovaries, the uterus, the fallopian tubes, breast. It also encompasses a wide range of issues from menstruation, fertility to sexually transmitted infections and hormone disorders. So gynecologists are basically medical doctors who specialize in this field and provide a care through various stages of the woman's life, from puberty through her reproductive phase to menopause and beyond. So the most important thing is, in gynecology we deal with preventive care. That is, in all the cases we are able to do some tests which can help us to preempt a particular diagnosis. So it needs routine checkups, pap smears, HPV vaccinations, which we have all heard about, to prevent cervical cancer and other diseases. Reproductive health can also be a very important part of this, which involves managing issues like menstruation, contraception, fertility and pregnancy. Sexual health leads to the addressing sexually transmitted infections, the sexual dysfunctions and other related conditions. In menopausal management, we deal with helping the woman to manage the physical and the emotional changes associated with menopause and the gynecological disorders, that is diagnosing and treating various conditions like endometriosis, polycystic ovarian syndrome, the fibroids, cancers and so on. So we will talk about a little about the historical background. In the ancient times, in gynecology, in the early civilizations in ancient Egypt, Papyrus Ebers, as far back as 1550 BCE, had an early medical text with gynecological treatments for the menstrual disorders and contraceptives. And in 1800 BC, the oldest gynecological text was published. Hippocrates in 460 to 370 BC wrote about the woman's health, uterine disorders and childbirth. And Soranus of Ephesus in the 1st and 2nd century authored Gynecology, covering obstetrics, childbirth and women's diseases, shaping future practices. So in modern times we have had many advances in which we have different kinds of instruments which help us to examine the patient and do our procedures, our surgeries with a little ease. So in the 19th century there was development of gynecological surgery with introduction to anesthesia, antiseptic techniques allowed for more complex surgical interventions. James Marion Sims introduced the Sims speculum. This speculum, which we know, this is the Sims speculum and this is the Cusco speculum. So Sims speculum has been of a very important role in gynecology. It helps us to examine the patient. It has a lot of things in which we are able to see properly even when there's a lot of bleeding or discharge coming. So basically he is known as the father of gynecology, and he developed surgical techniques to treat vesico-vaginal fistula as well. In the 20th century, pap smear test was developed by George Papanicolaou, and this revolutionized the early detection of cervical cancer. So as we all know, cervical cancer is a leading cause of death in India, and it's the most common cancer in India, and it's the only cancer which can be detected through a simple pap smear test, which has the screening test. Birth control pills or hormone pills were introduced for the women for the reproductive health. In 21st century, minimal invasive surgery, advances in laparoscopy and the robotic surgery have reduced the recovery time and the complications. Genetic research, understanding genetic predispositions to gynecological cancers and other conditions have improved preventive care and treatments. Now coming to reproductive health. So reproductive health involves the kind of periods which the lady has, what kind of pain she goes through, what are her expectations with regard to her job, and is she facing any problems. So menstruation, as we understand, is a monthly period which comes, and it can be normal or abnormal. It can include irregular cycles, it can include a lot of pain, it can include heavy bleeding. Second, coming to contraception, which involves different methods and their effectiveness, from barrier contraception to hormonal contraception and long-acting reversible contraceptives. Fertility is another important aspect of gynecology in the reproductive health, which addresses the infertility through diagnostic tests and treatments, including in vitro fertilization and other assisted. Now, very important to address sexually transmitted diseases, their diagnosis and treatment, very important part of gynecology. It's important to educate our young girls and all the women on safe sexual practices, use of condoms and vaccinations, and to reduce the risk of infections. It is very important to diagnose these infections, to understand what is the source, and to teach them how to safeguard themselves. So regular screening and tests to detect the infections early, even if they are asymptomatic, is very important. Now that the children are becoming very tech savvy and they have so much of access to the net, they have a lot of exposure to all these things and they accept this information willingly. So treatment includes antibiotics for this bacterial sexually transmitted infections like chlamydia and gonorrhea, antiviral medications of the viruses, especially to herpes or HIV, and managing symptoms and reducing their transmission. So sexual dysfunction also includes loss of libido, erectile dysfunction, pain during intercourse, and inability to achieve orgasm. This can be caused because of various factors, which can be hormonal imbalance, it can be medical conditions, psychological factors like stress and anxiety, or a combination of both. This involves a lot of counseling, talking to the couple and helping them to reach to a diagnosis of what is the problem actually. So it may involve lifestyle changes, counseling or therapy, medications which includes hormone therapy and antidepressants, and addressing any underlying medical condition. Now coming to menopause management. Menopause forms a very important scene in gynecology, and it is the last phase of a lady after she attains menopause, that is usually after 45 or 50 years of age. Nowadays we are seeing that menopause is coming even later. That means up to 55 years of age also the ladies keep having their periods. So when they go into menopause, 2 years before that they start feeling some changes, which include hot flushes, night sweats, mood swings, vaginal dryness, higher risk of osteoporosis, cardiovascular disease, or weight gain. Hormone replacement therapy can be given in the patients who are really suffering in menopause, who don't have peaceful night, they're not able to do their daily activities, they're not able to sail through the phase of menopause smoothly. So hormone replacement therapy definitely eases the severe symptoms and improves the quality of life. But the patients also have to understand that there's an increased risk of breast cancer, uterine cancer, and clotting, that is deep vein thrombosis, and cardiovascular issues. Okay, so it's very important to teach them that lifestyle changes are going to help them, which includes a balanced diet, a diet rich in calcium, vitamin D for bone health, a regular exercise, and support for cardiovascular health, which can reduce the osteoporosis risk as well. Now, common gynecological disorders which we see in the reproductive age group, which includes endometriosis, polycystic ovarian syndrome, and fibroids. Endometriosis, as we know, means the presence of endometrial tissue in the wall of the uterus or in the ovary, like we can see in this picture, or anywhere maybe on the surface of the uterus or in the peritoneal cavity. And this leads to a lot of problems which we are going to come to later. Polycystic ovary means when the ovary becomes bulky, it has small cysts, and there is a lot of hormonal imbalance which is characterized by weight gain, increase in the sugar, blood pressure, and irregular periods and all that. Fibroids are basically small growth in the uterus which are 99% benign. They are mostly non-cancerous and they can lead to heavy bleeding, pain, or they most of the time settle down with medicines. Many of them also need surgery. So beyond this, we also deal with ovarian cysts, we deal with adenomyosis, we deal with the menstrual disorders, that is, it can be oligomenorrhea, it can be hypomenorrhea, it can be delayed cycles, or it can be heavy flow. Then urogynecological disorders like stress urinary incontinence, or the patient sometimes develops a lot of problems while passing urine, that is itching and pain without any infection, so they need some hormone replacement therapy. And in a few cases we can also deal with Mullerian anomalies. Mullerian anomalies include imperforate hymen or absence of the vagina, septum in the vagina, or maybe the uterus is absent. So all these things are all related to congenital defects. Now coming to history taking. In gynecology, the first thing which we do is menstrual history taking. It is very important for us to have a very good understanding of the patient's periods. So first of all, we have to ask about the age of onset of the first period, that is known as menarche. What age the period started. Then we have to ask about the regularity of the period, that is whether the period comes on time every 30 days, like 28 to 30 days is the usual cycle. Then the duration of the cycle, that is, does the period last more than 5 to 6 days. Then amount of bleeding, is it too much, is it heavy, how many pads she's changing in a day, is there any passage of clots, does she have a lot of pain. Pain also signifies that there might be heavy bleeding. Okay, and the first day of the last menstrual period is extremely important. Then, so menstrual history usually is written as maybe 4 by 28 days. That means 4 days she bleeds every 28 days. Okay. So in this diagram, we can explain the monthly menstrual cycle. So basically, this is the monthly cycle just after the monthly bleeding, the uterus, the tubes and the ovaries. Now when this lady is in the follicular phase, that means she's just had her period, the lining is quite thin as we can see here. Okay. Now in the next 10 days, 10 to 14 days, the egg starts developing and this egg gets released from the ovary. So this is called ovulation. As the egg gets released from the ovary, the estrogen which was there in this phase also gets overpowered by the progesterone in the second phase when the ovulation occurs. Now because of this, the lining starts becoming thick as we can see here. As compared to this, this is a thicker lining. Okay. So the egg gets transported from the ovary into the fallopian tube. If the sperms don't come, if there is no pregnancy, then this egg gets dissolved on its own and this lining gets shed off in the form of blood. If the lady is married or she's sexually active, the sperms are there, then fertilization takes place in the fallopian tube. The zygote which is formed gets implanted in the uterine cavity and then the pregnancy continues. Okay. After we have taken the menstrual history, we next come to the obstetric history. In obstetric history, we basically ask about how many times the patient has got pregnant, about the detail of each pregnancy, whether it was an abortion or it ended up in a full 9-month pregnancy, whether it was a singleton pregnancy or it was a twin or a triplet or a multiple pregnancy. Then did she have any history of bleeding, was she admitted during pregnancy, any history of any surgeries, cesarean or any other admissions, a stitch being applied in pregnancy because of a weak cervix, or was there any post-operative wound infection. Then it's very important to understand how many times she's had a DNC, was there any history of molar pregnancy, because each of them have an implication on the future pregnancy. So many times the complaints may be related to pregnancy complications or lactation as well. Next is past surgical history. So we need to ask whether the patient has had any history of any other surgery, that is any cyst surgery, any other surgery on her intestine, any hernia surgery, any gallbladder surgery, appendix or kidney, any stone, any other relevant medical disorders, whether she has any history of sugar, high blood pressure or thyroid, or any other relevant history, whether she has any, sometimes the patients have headaches, migraine, or they have a history of some meningitis, or they are on some blood thinners which will have an implication on the current surgery if we have to do. So it's very important to understand about their medical and the surgical history and what all medication they are on. Another important part of the history taking is family history. Family history gives us an idea about what the patient can be prone to. So many times when we deal with a patient with PCOD, they have a family history of high blood pressure or diabetes or PCOD in their family. Maybe their mothers and their sisters have been suffering from it. Okay? Or if there's any history of malignancies like breast cancer or uterine cancer or ovarian cancer, sometimes which can be genetic, or colon cancers. So those histories are very important for us to ask. Another important part of history taking is personal history. Now in today's scenario, it's very important for us to understand. So in today's scenario, it's very important for us to understand that we are dealing with people who have migrated from their hometown into maybe a city where they are working or they've come for marriage. So there are a lot of stresses going on in their life which can lead to drug abuse. Whether the patient is working, from in the night shifts, or whether she has long working hours, she's not able to take care of her health, she is married or she is unmarried, divorced or separated, details about the sexual life, that is very important. Then we need to ask about the personal history, about history of smoking, alcohol, drug abuse, any history of domestic violence, any important information about allergies, whether she is allergic to any medicines or any other foods. Then history about immunization, importantly to ask about COVID vaccinations and about HPV vaccinations. Then about her lifestyle, whether she is active or she is sedentary, she has to sit all the time. That has importance for our management, especially in the cases of PCOD.